Good afternoon. Before we begin our COVID update, I want to make a statement regarding the situation we're seeing in Washington, D.C. We are all disheartened and shocked by the violence that is engulfing our nation's capital. The simple reality is, while we respect the right of people to peacefully protest and express their First Amendment views, there is no place for violence and intimidation in any protest. The results of this election will stand, and our democracy will not yield to intimidation, to threats, or to violence. And we continue to call and advocate for peaceful resolution and folks to express their First Amendment rights in a respectful and calm way. Let's transition into our COVID update. We're going to have a new format starting the new year. We've heard from a number of members of the media and community who have asked us to streamline and cut down the presentation of data and charts. All of the data and charts that we have been showing throughout the course of the last year will still be available on our website, will still be published in a very transparent way, and we're still happy to answer questions related to them. But we want to make sure that we reserve a significant chunk of time for question and answer, and so we're going to streamline that. I'll give a brief update. You'll hear from Supervisor Nora Vargas, who is the new member of the COVID-19 Subcommittee. Our public health doctors are here for questions, and we wanted to be able to devote more time to the question and answer component of our press briefings, and so we hope this will help facilitate the sharing of information and the discussion that we come. As we begin a new year, it is a time for us in San Diego County to have a renewed focus on tackling COVID-19. The holidays hit us incredibly hard. We saw what happened with the surge surrounding Thanksgiving. We are anticipating an uptick in cases as a result of Christmas and New Year's. Based on traffic patterns and airline patterns, it seems that probably not everyone followed the public health orders surrounding the Christmas and New Year's holiday. And when you add on top of that the precarious situation our healthcare system is in, the tremendous strain on our ICUs, the continued increase in cases, and when you add on top of that the presence of the UK variant, a strain of the virus that we believe is much more contagious. We now have dozens of cases in San Diego County. They are not connected to one another by relation or geography. It is also important to note that a very small number of positive tests are screened for the UK variant, so the actual number is likely significantly higher than what we are aware of. And all of those factors combined together force us to have to refocus our energy around the basic things that we know to do. It is a new year and we need a new focus, but the things we do to avoid COVID remain the same. Wear your mask, physically distance from non-household members, only leave your home when it's absolutely essential, and please go get your flu shot and get ready to get your vaccine for COVID. On the subject of vaccines, again, the vaccine system and the way they go out, we get a lot of questions around this. A lot of entities are receiving the vaccines directly and are administering them consistent with the tiers, and I'm going to review the tiers and where we are in the state of California and in San Diego County. Healthcare providers are getting vaccines direct. The Department of Defense, the VA, CVS is getting them for distribution, and the county is playing a support role in a safety net type work. And as the county, we are working as an air traffic controller to try and coordinate and integrate and work together in order to ensure adequate distribution of the vaccines. Invariably, it is going to be a bumpy path. It will be some bumps in the road as we go. But the good news is we are talking about vaccines, and people every day in San Diego County are being vaccinated. Right now, the focus of who is getting the vaccine is our healthcare workers and employees and residents of long-term care facilities. And I will walk you through a quick chart here that shows you where we are. So phase 1A is what we are vaccinating now. These are healthcare personnel and employees and residents of long-term care facilities. These are Tier 1. Again, you see there acute care psychiatric hospitals, skilled nursing facilities, paramedics, dialysis centers, behavioral health residential facilities. These are all folks who are in phase 1A. There are 3 tiers to it. These are the only folks that are getting vaccinated right now. We'll take a second look here at Tier 2 and Tier 3. Again, this is the same phase 1A. Again, this is Tier 2, intermediate care, home health care, and some supported services, community health workers. You can see the list of the individuals who are here. Essentially, all of phase 1A, all 3 of these tiers are now open for people to get vaccinated. What individuals need to do, if you fall into any of these lists that are up there, you need to contact your healthcare provider. Your healthcare provider, where you normally go to get your healthcare coverage or treatment, that'll be the entity that will be working through. And again, these are some large numbers of San Diegans, much larger than we have number of vaccines here in the county right now. Call your healthcare provider, and they will have in place a system to help you do it. And the county is working in a role to try and support and aid and assist our healthcare system. Once we get through this phase 1A, then we will move on to the next phase, and we will keep you apprised of where we're going. We continue to work on collating the data of how many vaccines are here, how many have been given, and we certainly hope by next week to have good information. But there's a lot of entities involved. There's a lot of moving pieces. So we will continue to work through this. Every San Diegan should be prepared to receive the vaccine when it is your turn. And we will do everything we can to continue to coordinate all of the entities across our healthcare systems. I have been encouraged recently by actions around stepping up enforcement of our public health orders. There is no desire to be punitive, but the people who pay the price for individuals that are blatantly defying the public health orders are our vulnerable citizens and residents who are impacted and are losing their life. Our healthcare workers, folks that are denied access to care because hospitals are having to make adjustments of who can come in and who can't. And the simple reality is our public health orders are only as effective as the broad-spread cooperation and compliance and the enforcement to ensure that. I want to thank Mayor Todd Gloria, who's been willing to step up enforcement in the city of San Diego. His efforts are appreciated. We are grateful. We continue to coordinate with the city of San Diego on each of these actions, and we are grateful for them. I also want to thank the Alcohol Beverage Control, who again has been willing to step up their actions around enforcement, around egregious blatant violators and potential super spreading events, and a number of other cities that are exploring different ways that they can be a part and assist us in the efforts to ensure enforcement. I talked to our enforcement team and got a rough sense of what we look at. As we have complaints come in, we evaluate those complaints, and we find that in general, about 90% of the entities come into compliance after an initial investigation or an initial contact. That is encouraging. Out of the 10% that don't, we issue a cease and desist letter. More than half of those who we issue a cease and desist or public health closure letter to do come into compliance after receiving that letter. The ones that are left are the ones that get referred to law enforcement for citation, and then either to the city attorney or district attorney for prosecution. And again, we appreciate everyone's cooperation as we work through the challenges we face surrounding enforcement and the very difficult situation we face with COVID-19. Now let's jump into our streamlined charts for today, and then we'll hear from Supervisor Vargas, and then we'll jump into your questions. All of our public health doctors are here for the Q&A and discussion part. You'll see here on the first chart today we're reporting 3,815 cases. You can see over the last few days the number of tests were down. That is a natural dip that came out of the New Year holiday, and we see those numbers ramping back up in terms of the number of tests today, 26,320 tests being performed. Again, the purple line there representing our 14-day rolling average of percentage of positive cases, 14% for the day, but you can see the trajectory over time. Again, that continues to go up. Next on our hospitalization chart, again, the numbers continue to go up. You see a slight bump in our ICU utilization. These are COVID patients in orange in ICU, the blue being the total COVID-19 related hospitalizations, and you can see again the numbers continuing to climb. And I just want to remind everyone that there is a significant delay, 21 to 24 days between a surge in cases and a surge in hospitalizations, and we expect the holiday cases to arrive soon and a corresponding increase in hospitalizations to continue certainly through the end of the month. And then the last chart here is our ICU availability. You can see on the bottom there, 384 is our COVID-related ICU census in our area's non-federal hospital system. 249 is the non-COVID ICU utilization. And we limited this chart to just a few days to make it easier to read, but if you go back on the website and look over time, you can see those non-COVID numbers have shrunk significantly. These are individuals that are having the care they need delayed or denied because they have to make space for COVID-related patients. The number in the box you see right there, 39, that is staffed and immediately available ICU beds for the entire county. And again, this number fluctuates day to day, slight variant between how we measure that in the state. But again, it gives you a picture of the nature of the healthcare system and the challenges that our hospitals face today. With that, I would like to introduce Supervisor Nora Vargas, who is the new member of the COVID-19 Subcommittee. She'll share a brief update, and then we will jump into your questions. And all of our public health doctors are here and available during Q&A. Supervisor Vargas.
Thank you, Chair Fletcher. I am really looking forward to working with all of you, particularly with our subcommittee, on tackling this global pandemic that has particularly impacted our communities, not only in the South Bay, but our communities of color in general, disproportionately. I cannot stress enough the importance of following public orders, and as we do our work in the county to distribute treatment, continue testing, you are our partners in our community, and we need you to make sure that we can continue to move forward. As we continue to ask all of you to do your part, wear your face mask, avoid gatherings of any kind. This is the only way we can prevent the spread of, until the vaccine is available to everyone. I did want to share that I did have a chance to tour one of the vaccine sites this weekend with some of our first responders and the work that they're doing in our community. And I cannot thank the county staffs enough for the work that they're doing as we are trying to figure out and anticipate what the challenges will be. I do want to mention that our Health and Human Services Department is committed to making sure that we're providing the most updated information to our communities, and we're going to do everything we can to make sure that general public and that the community is part as we're trying to distribute vaccines to the general public. One of the things that we're going to be doing a little bit different in our subcommittee is that we are going to be sharing the information in language in Spanish. This time we are not going to have translated in Spanish, but we will for the next time, as well as the slides. Así que me es un honor para mí estar con todos ustedes como miembro de este subcomité, como la primera mujer latina, la primera mujer de color en esta organización. Estoy comprometida a que la información para nuestras comunidades esté no solamente al día, pero que podamos entregarla con todos ustedes. Como mencionó el líder, Supervisor Fletcher, ahora empieza, el 31 de diciembre no cambiaron las cosas, la pandemia ocurre, continúa siguiendo, impactando a las comunidades a muchos diferentes niveles. Es muy importante que, por favor, estamos viendo que hay esperanza porque va a haber una vacuna ya para las comunidades, pero en realidad todavía tenemos que estar protegiéndonos. Las personas les pedimos, por favor, que usen sus cubrebocas, que estén a 6 pies de distancia de las personas, que hagan el favor de no tener convivios con personas que no son parte de su comunidad. Existen todavía grandes retos. Tenemos el problema de que después de los eventos del Día de Dar Gracias y ahora con la Navidad y el Año Nuevo, hemos tenido un gran impacto y nuestros hospitales están saturados. Las camas de emergencia, en realidad el COVID ha tenido un impacto muy grande en nuestras comunidades. Como les comentaba, las vacunas ya están disponibles para muchos miembros de nuestra comunidad, primeramente para todos aquellos que nos están, lo que le llamamos las personas que están, los doctores, las enfermeras, las personas que de veras necesitan ahorita esta vacuna, porque son las personas de la salud pública que nos están ayudando, que son parte de los diferentes niveles que van a entregar las vacunas. Primeramente, también queremos comentarles que yo sé que muchos de ustedes están haciendo el trabajo de quedarse en su casa, protegerse, pero hay unas personas que no han hecho lo que tienen que hacer. Entonces estamos agradecidos con el alcalde Gloria, que ha hecho un gran cambio para que los negocios que no estén cumpliendo y que han violado los órdenes de salud se les multe y que haya una oportunidad de que hagan las cosas mejor, ¿verdad? También la otra que queremos recordarles a todos ustedes es que es muy importante que todos sepan que aunque existen personas que han estado impactando y que no han seguido las órdenes, sí se les está multando, sí se les está yendo, porque sabemos que es importante que todo mundo cumpla con las órdenes de salud, que es lo más importante. Así que es algo diferente a lo que estamos haciendo ahora, que vamos a estar traduciendo la información en español para que las comunidades lo tengan, y estamos comprometidos a entregarles toda la información que necesitan. So it is my honor to turn it over to Chair Fletcher.
Thank you, Supervisor Vargas. This time we'll go to Q&A.
Our first question is from Lori Weisberg with the San Diego Union Tribune. Please go ahead.
Thanks for taking my question. I want to return to what you mentioned, some quick stats at the outset about enforcement. And I'm trying to get a deeper dive into that and get a sense of if the enforcement is really having any kind of consequences. There are hundreds of cease and desist orders so far, and I don't get a sense of how many of those cease and desist orders have reflected compliance or not, because there's only a fraction of those cease and desist orders that have been moved on to the District Attorney's Office or the San Diego City Attorney's Office. Very few citations being issued. So I'd like to know what proportion of the actual cease and desist orders you're seeing compliance. Are you frustrated? Is there too much? Is there too much of time and there's not enough resources to follow up on all these cease and desist orders because we keep hearing from the public that some restaurants continue to serve outside? Or is there part of the problem that the officers and the co-compliance officers are reluctant to be too hard on businesses knowing that they're fighting for their survival? So it's a real big question about how well is enforcement even working.
Well, I think in general, Lori, the issue around enforcement has been very frustrating, both from an effort that the public health orders are just facing the difficult realities of the situation we are confronted with COVID-19. And the more compliance we get, the quicker we will be able to be open. And the more compliance we get, the quicker and longer we will be able to stay open. And so the public health efforts really are designed not only to save lives, but to save business. And so, that is an ongoing challenge. I think enforcement has been a great struggle throughout this in terms of the sheer volume of what we face, in terms of the ability to get out. I think we are doing everything that we can as a county, recognizing that everything is not within our power and ability, particularly the law enforcement aspect. I think with the new board, we can revisit some of the decisions that were made previously about how many folks we allocate towards enforcement or what posture or tier. But where we are right now is as we get a complaint, we follow up and investigate. We work with the cities on those. And what has been shared back is the overwhelming majority. Once we do that investigation, they come into compliance, or perhaps they were in compliance. Again, out of cease and desist letters that have been issued, what's been conveyed to me is about 60% of those after getting the letter come into compliance. I think you ask a fair question about which ones those are. The ones who don't come into compliance, again, we do refer those to law enforcement to issue a citation, but that really is and has to be a question directed back to those entities about when they issue the citations. But we're greatly encouraged by what we've seen with the City of San Diego and their willingness to step up under Mayor Gloria's direction. And we certainly hope that other jurisdictions and entities will continue to do the same. And we'll keep looking each and every day for ways that we can find to increase compliance. And it's not out of a desire to be punitive in any sense. We understand folks are just trying to make it. But we have to do these things as a community in order to get through this. And it's also inherently unfair for those entities who are following the rules and who are doing things right to see other individuals who are not. So we'll keep working on it, and we will keep refining and doing everything we can to try and get us through this.
Okay, thanks.
Thank you.
The next caller is Hunter Sowards with KUSI.
Hi, yes, thanks so much for taking my call. Kaiser is now delivering their second doses of the vaccinations this week. I'm sure there are other hospitals that are doing this as well, but the total really being given right now is still much lower than we expected. What exactly is being done on the county side to help hospitals with these plans, and why do we think we're seeing such a slow rollout? And then my second question has to do with the new variant. I'm wondering if Dr. Wooten or Dr. McDonald could give us any additional information on the vaccine's effectiveness. I know a lot of people are very curious about that.
Yeah, I'll have Dr. McDonald address the variant question. When it comes to vaccines, we are doing everything we can to coordinate with every entity to help them in whatever ways they may need to ensure that they're getting the vaccines out there. There is going to be a little lag in terms of the reporting back of when they give the vaccines. That still has to be uploaded into a system to get where it is. We are encouraged, though, that people are getting the vaccines. We're encouraged that we're now moving into the second shot of those initial ones, and we hope that as we work with the state to streamline these systems, we want to provide really accurate information in real time about how many are here, how many first doses have been administered, how many second doses have been administered, and those systems are still coming together, and we continue to work with the state to make sure that we have clarity around that information. Again, understanding how many different entities are involved in this process that are all unique and standalone entities. So we're going to continue to play our traffic controller, and we think in the coming days and weeks we will have greater clarity on the data surrounding the distribution, and we will continue to support all of the entities out there, ensuring they do. Everyone wants to get the vaccines out. Everyone wants to get people vaccinated, and we want to get there as quickly as we can, and we will do that. I'll turn it over to Dr. McDonald for the question about the variant and the vaccination.
Thank you for that question. Well, the variant, of course, has only been with us for a short period of time, and the vaccine has only been rolled out also for a short period of time. And so the first answer is we don't know for sure. The first true answer will probably come out of England because they've had the longest experience both with the variant and with the vaccine. But our virology and vaccine experts tell us that there's no reason to believe that that the vaccines that are being rolled out now will have any less effectiveness for this variant, just based on how the vaccine works and what this variant looks like. But the definitive true answer won't be out until some scientific studies are available, and we know that they're looking at that in England.
Thank you.
Thank you, Dr. McDonald. We'll go to our next call-in question.
The next caller is Jack Mulmood with CBS News 8. Oh, sorry. Go ahead, please.
Go ahead, Jack.
Hi. Hope you can hear me now. Thank you, first of all, for taking my question. I have a kind of a two-parter here. I know Supervisor Fletcher, you kind of got a little bit into the process of cease and desist orders, but just to reiterate, can you walk us through the process of how a business receives a cease and desist order? Is there like a criteria of complaints from people that they call into 211 for? And then is there like any investigation done with the business when somebody complains about them?
Yep. Yeah, Jack. So what happens is someone makes a complaint. It is presently a complaint-based system. We have our complaint line that is out there. Once that complaint is received, there is an investigation that is done to determine if there's validity, are they not in compliance. At that point, they will be visited by a public health enforcement person to assess the situation that's there. They'll be educated. If they're out of compliance, they'll be told. And again, the overwhelming majority, when they get that visit or they get that contact, make the decision to say, okay, I get it. Maybe they didn't know, maybe they knew, and this was enough. But the overwhelming majority come in compliance at that point. If they do not come into compliance, then the county will issue a cease and desist order that will be served by law enforcement. Again, when individuals get that cease and desist order served by law enforcement, the majority of them then choose to come into compliance. If they do not come into compliance after that, that's when it gets referred to law enforcement for the issue of a citation and then the referral to the city attorney or district attorney. Now, that doesn't mean that every business that is out there that is not following the rules makes their way into our system, because it is presently a complaint-based system. But that is how it rolls out. And again, we share those cease and desist orders, and we get a significantly large number of complaints. And we have an enforcement team, again, that is diligent at getting out as quickly as they possibly can to investigate each of these and take appropriate action.
Yeah, and then my second part to the question, and I know you answered the question earlier, and I think you said 60% of those institutions that do get a cease and desist order end up complying. Do you have a hard number offhand about how many businesses were actually issued a citation, like a fine?
I don't off the top of my head, but I can try and track that down for you.
Thank you.
Great, thanks. Next question.
This question will be from Jonathan Wozen with the San Diego Union Tribune.
Yeah, thank you. So I have a question about where we're at vaccine-wise and where we're going. In terms of where we're at, kind of circling back to, I think, Hunter's question. So my understanding is that as of Monday, the county may have received in total about 200,000 vaccine doses, not including CVS, Walgreens, not including what's going to the military, and that around 47,000 of those have been administered.
Yeah.
I think you mentioned reporting delays, but just in terms of that gap between what's been received versus administered, do we have a sense that a lot of that has to do with reporting delays, which you would expect, or is there a sense that there are doses that are in the freezers but not necessarily quickly going out into the arms of healthcare workers and people in nursing homes? So it's a question about where we're at right now.
Yeah.
As far as the next step of getting the phase 1B, do we have any idea of when that might happen? Is it going to have to be, after all healthcare workers have gotten their first shot? Do they have to have gotten, both shots? Do we have to completely wrap up phase 1A to move to 1B? And then when might that happen? And then how, with people in phase 1B, how would somebody who's 65 or a grocery store worker know that it's their turn? I think Supervisor Fletcher mentioned, as you hear that it's your turn to reach out to your healthcare provider, but for folks who aren't tuning into the pressers or necessarily closely following what we've been reporting in the media, how are they going to know when and where to get vaccinated?
Yeah, thank you for that. So let's take the second part first, and then I'll take the first part second. We are in phase 1A right now, but there is a significantly large number of San Diegans who are in phase 1A, and so it's going to take a little bit of time, I think, to get through phase 1A before we move to phase 1B. And so our focus and priority right now is just letting folks in phase 1A know, hey, the vaccine is open for you. It may not be available, but it is open. Please contact your healthcare provider, and they'll have information about their process, their distribution, where folks go. And as the county, will continue to work to support that as best we can and fill in gaps where needed. But it is going to take a little bit of time to get through that. As it relates to your second question, that's really what we're trying to drill down on, is exactly how many have come to San Diego County. Because again, there's so many entities that receive them direct. You also have multi-county entities. Kaiser, for example, is a multi-county entity, so they get sent a number, but it's for multiple counties, and so trying to assess out of that. And then you have the DOD and the VA on top of that, along with CVS, which gets them direct from the feds. My knowledge and understanding is we're just probably over 100,000 roughly, but again, we're not completely sure because so many of those entities, we're still trying to tie that into a common reporting system. And we think that well over 50,000 have been administered. But again, there is a delay in the San Diego Immunization Registry, SDIR. Pharmacists, for example, have 14 days to enter into that system if they've administered a vaccine. So there will be a delay as that system starts to catch up. I think in general, it's natural. We've waited all year for the vaccine. It's here. We want to get them all out right away. And I think as we move forward, you will see those processes streamlined and expedited as people begin to get their systems in place and begin to get the process of receiving the vaccine, giving the vaccine out, entering that information in. I think a lot of that will be smoothed out. We certainly want that done soon, and we will continue to work and support all of the partners as best we can, again, playing a role of kind of air traffic controller and trying to help and assist where we can.
Thank you. I appreciate the answer.
Yeah, thank you. Next question.
This next call is from Brandon Lewis with CBS 8.
Thank you. Just piggybacking off of that, we're hearing a lot of criticism from our viewers about the transparency, about the number of vaccines that have been given. So what's the status of the vaccine dashboard that was discussed last week? And then I have a second question as well.
Yeah, when we have the data, we will share the data. We are working with the state to get clarity around definitively how many have come to our county. And as soon as we have that, we will be completely transparent with that. We continue to push. It's frustrating. We would like to know today exactly how many are here. And again, there is some complexity to it. You understand, with so many entities, with so many federal entities, with folks getting from the state, with multi-county ones. I wanted that when this first started, and we're going to continue fighting, working, and as soon as we have that, we will share that.
Thank you. And I also have a question for Supervisor Vargas. Your district has been particularly hard hit by coronavirus. So what immediate changes are you pushing for? Perhaps to help get over the general apathy towards the health order, not just here, but we're feeling it across the country. So can you talk a little bit more about specifically your district?
Yes, I think one of the things to mention that I'm really proud of the work that the Latino Coalition of San Diego has done in partnership with our Health and Human Services Department to get the information out to our communities. I think information in language is critical for District 1. We will be presenting some information, and particularly specifically presenting some more letters related to health equity and what that looks like, and how do we make sure that we bring the needed resources into our district. One thing to mention is that we are hopeful that we will get additional dollars through the change in administration. I think that's going to have a clear impact in our communities, specifically the CARES Act. And our small family businesses in District 1 have been greatly impacted as much as our communities as well. And so my priority is to continue to work in partnership, be a voice on behalf of District 1, and have been already having a lot of conversations. We'll be meeting this week with the mayors of my jurisdiction, my district, as well as leaders. We are working together for the rollout of the vaccine as well. And so they're going to be an integral part of the plan that's going to be shared at the county. Thank you.
Thank you, Supervisor.
All right, thank you. Next question.
This call is from Melissa Adon from NBC 7.
Hi there, yes. Good afternoon. First, I'd just like to say, as a colleague of NBC 7 and Telemundo 20, I do want to thank having the Spanish language information provided by Supervisor Nora Vargas. So that is very helpful, of course. My question, however, is in reference to the vaccine rollout. Obviously, the big deal here that we're seeing in San Diego. What I want to understand is what's going to happen for individuals who choose not to vaccinate. It's something that is coming up, especially including frontline workers like first responders or nurses or officers. What's kind of the plan with those instances?
Yeah, we're going to do everything we can to build confidence and faith in the vaccine. We have community advisory groups we're engaged with. We have trusted messengers. There are a number of programs that are coming up to try and walk people through a lot of concerns they may have. For example, one common concern you'll hear is people say, well, I don't know if I don't think I want to get it because it was rushed. And when you walk folks through the nature of vaccine distribution, in a normal vaccine for a normal situation, they have a number of steps, but they do them sequentially because there's not the resources available. Well, in this instance, they were able to do those steps simultaneously. And so the vaccine covered all of the normal safety protocols and steps that any other vaccine covers. They just got some bureaucracy out of the way, and they had the resources to do it faster. And so there are a lot of things like that over the course of the vaccine distribution, we think we can work with communities, we can work with trusted messengers and partners, we can answer questions, we can provide information. As we get further along in the vaccine distribution, you'll also be able to see that people that got it early, they're doing okay. They didn't get COVID, and they're doing fine, and we think all of those things will build confidence, along with the fact that if we want to reopen, and we want to get our kids back in school and our businesses back open and go back through all of those issues over time. The good news is there's more people who want the vaccine today than we have vaccines available. And so I think the question you raise is one we're going to work through with education and with engagement, and we will continue to work through that as we go through the process. So it's a very real concern, a very valid question that we get frequently around concerns, and I think in large part we have to work through this. There will certainly be a percentage of folks that wouldn't ever get any vaccine that's available, but we think we can work through and get the overwhelming majority of folks comfortable with the data, with the science, and with the desire to get our way of life back.
This next call, the last call is from Paul Sisson with the San Diego Union Tribune.
Thank you for taking my call. And for the first time I can remember, I guess going back to late January, there were no medical professionals involved in today's main presentation. Is that a new approach going forward, and if so, why?
No, Paul, that's not true. You just heard from Dr. McDonald. Dr. Wooten is sitting right here. We were just trying to streamline the early presentation of data so we could make more time for very insightful and astute questions like yours. So if you have a question for Dr. Wooten or Dr. McDonald, they are here and eagerly awaiting answering your questions.
Thank you.
Okay. You have a question?
Oh, well, I guess another question might be, has the county been notified of any hospitals or health systems having to engage in crisis care?
We'll have Dr. Wooten, our public health officer, who's here ready to answer that question.
Good afternoon, Paul, and thank you for that question. As everyone is aware, the state issued guidance for hospital surge, health officer's order. And actually, by close of business today, all hospitals are to have their crisis care plan available and submitted to the state as well as to our local health department. So in transparency, when they submit those to us, we will post them on our website. And once a system identifies or declares that they are going into crisis care, that hospital or that system will make the announcement to the public, and then we will also post that information on our website. So that is our current plan. And to answer your question specifically, at this point, there is no hospital or hospital system that has declared that they are in crisis care mode. Thank you.
Thank you, Doctor.
Next question.
There is one text question today from Carlo Cicchetto with Channel News 8. We're hearing about ambulances waiting for hours to get into hospitals in Los Angeles County. Is anything stopping these ambulances from just driving down here with their patients?
Thank you. We'll have Rob Seals address that question for you.
Thank you, Carlos, for that question. It gives us an opportunity to talk about the EMS system and the medical health operation coordination. Within each county or of California, EMSA puts together regions. And if a county is overwhelmed, and in the case of your example, an ambulance cannot offload at a hospital, they will be directed with the base medical from different hospitals, as well running through EMSA, to go to another hospital in the county. And when that can't happen, it'll go to another hospital within their region. Region 1 has LA County, Orange County, Ventura County, Santa Barbara County, and San Luis Obispo County. So that ambulance will be handled within that region. And then if that becomes overwhelmed, they will work directly with the state to go from region to another region. And then that's when Region 6, which San Diego County is part of, that's when we would be engaged. But again, this is handled in a city, and then a county, and then a region level. And that's why the ambulances will stay up there. Thank you.
Thank you, Rob. Next question.
Next text question that just came in is from Laura Acevedo with ABC 10 News. With the UK variant spreading in our county and the suspicion that there are more cases still undetected, why are all cases not being screened for this variant?
We'll have Dr. McDonald address that question.
Yes, thank you for that question. This variant was first discovered in England by a process called a whole genome sequencing, which is a very specific type of analysis that can only be done by select laboratories. We're fortunate here in San Diego to have the Scripps Research Institute and also Illumina, which is partnering with Helix, and a couple of other small entities that can do this whole genome sequencing. This is different than the diagnostic tests that are used to routinely diagnose COVID when you go up and get your test from your healthcare provider. So it's really a system behind a system, and we only have the capacity to test a very, very small percentage, actually far less than 1% of the tests that are actually conducted in the county can be sequenced like this. We are actually attempting to increase our capacity to do that, but we have a good system in place which did in fact pick up these cases. At this time, we have 28 confirmed whole genome sequence cases that are this specific variant. And as of today, we actually now have 12 epidemiologically linked cases, that is, individuals who have COVID by the diagnostic test that I described, that are household contacts or directly linked to one of these whole genome sequence diagnosed cases. So we're up to 40 confirmed and probable cases. I hope that answers your question.
Thank you, Dr. McDonald. That concludes our press briefing for today. We will be back next Wednesday with an additional update. Again, we continue to encourage everyone to take seriously the challenge that we face with COVID, with cases, with the new strain, the impact on our hospitals, and what we know is going to come from the holidays. Let's start a new year with a renewed focus to slow the spread and knock this back. Thank you.